Bhavya, we are live on both the pages. You can start recording and start the
Okay.
discussion.
Yeah. Okay. So good afternoon, everybody, and welcome to our 28th session of the Unsung Heroes. So today we have a very special two guests with us. That is Mr. Vikram and Miss Simi. So welcome, Vikram and Simi, for today's session. So these two optometrists are doing exceptionally well in their practice. So I would like to introduce all of you, Vikram, for today's session. So Mr. Vikram had graduated bachelor degree in optometry from Elite School of Optometry in 2018, and after graduating, he joined Shankar Netralaya Eye Hospital as clinical optometrist, and he had specialized training in electrodiagnostic procedures, and also he has focused on his subspecialty in this for 2 years. In 2022, he began his independent optometry practice in his hometown, that is in Cheyar, and now he has successfully completed 3 years of his service, and he provides comprehensive eye examinations for the patients, and also he does a little bit of vision therapy and also low vision services. And one of his proudest contribution to the community is the early diagnosis of glaucoma, which he had seen in 6 patients, and he also does maintain the electronic medical record system. So he is happy that he has already completed 1,000 patients in his 3 years of experience in his clinic. And addition to that, he also conducts home eye testing for geriatric patients, and he also organizes school screening camps wherein he has screened 700 plus children and also prescribed glasses for them. And with a strong interest in continuous education, he also attends regular meetings, webinars, and conferences to stay updated. So, right now, he's pursuing master's degree in optometry from Dr. Agarwal's Institute of Optometry. We welcome you, Vikram, for today's session.
Thank you.
And also, I have a video of Vikram's clinic and his work that he does. So let me just share my screen as well.
Thank you so much, ma'am, and Team OCI for this beautiful introduction.
Thank you, Vikram. That was really nice to see your clinic and also the work that you do in the community. So now it's my turn to introduce Miss Simi Afroz for today's session. We welcome you, Simi. Uh, I would like to introduce Miss Simi, who is the director and chief optometrist at Vision and Vitality Center. She has completed her She is an alumnus of AIMS, Delhi, and Amity University, and she brings a strong academic foundation and clinical insight in her practice. She's also specialized in vision P contact lens, low vision rehabilitation, and also early intervention therapy for children with ASD, ADHD, Down syndrome, and also sensory processing disorders. She has also previously served as an assistant professor at Sharda University and GD Goenka University. Her dedication to research is evident through her multiple research papers, and she has also been recognized with several prestigious accolades, including Young Achievers Award and Best Poster Presentation. So she also runs her clinic along with conducting many vision screening camps in schools and institutions across Aligarh. So we welcome you for today's session, Simi. Sakina, can we share Simi's clinic video, please?
Yes.
Thank you, Sakina. We welcome you, Simi.
Thank you so much, ma'am, and thank you so much, Optometry Confederation of India, for highlighting my work like this.
It's so happy to see most of the IEC materials in your clinic. That really makes us very happy to see from OCI there are so many IEC materials which is helping you out in your clinics. So before any further delay, let's get into the discussion. So my first question is for Vikram. So Vikram, what was your motivation to start your practice?
So actually, I like being more in the clinical practice where we see patients regularly. So that's why I joined Sankaranethralaya right after my graduation. So main thing I came here was my father. So he motivated me mainly to start this practice. I was more into clinical side of the patient uh, connection. So he wanted me to establish something in our hometown where we can serve patients of our community. So that was the first step I did, and I started here in June 2020.
That's nice, Vikram. Of course, I understand coming from a electrodiagnostics background to running a clinic, it actually takes a lot of courage to start your own practice. And I'm sure now you have started newly. So, what are the, how do you find the interest to join in this optical industry?
So here also my main focus runs on the clinic only more than optical industry. So I give
Okay.
main focus to the clinic more than the business or whatever it is.
Okay.
So any patient who comes in should be given proper justice. So any patient who are stepping in, I am doing comprehensive eye examination to everyone, right from vision check, refraction, then anterior segment evaluation using slit lamp, then cover test, basic by orthotics like NPA, NPC to whomever it is required. And to everyone, I'm doing this applanation tonometer to all the patients who are entering the clinic. In that way, I think I am doing a good service to all the people entering my clinic by giving comprehensive eye care examination.
That's nice, Vikram. So my next question is to Simi again. What was your motivation to start your own practice?
So it was, it, we can say that like for a girl after marriage, it is next to impossible to stay at the mother's place, right? So this is the main reason behind opening the clinic. I got married, and now I have to shift in Aligarh. I was searching for a job, but I find that the person who will give me job is not that. I am not capable of that job. Like more of the job which I'll get in Aligarh is of clinical, and I am from the academic because
Yeah.
I worked as an assistant professor in Sharda and GT Goenka, and at that time I thought that let's just start with the clinical. Then I realized, why don't I open my own clinic?
Okay.
Once I started, let's just open my own clinic. In between these, like when I was professor, assistant professor at the university, me and my husband, the he is an occupational therapist. So me and my husband was discussing the things, like he is an occupational therapist. He mostly see ADHD and Down syndrome patient, autism patient, and some of these patients like learning disability patients, right? These patients more of they or he sometimes or me sometimes stuck in between, that whether the therapy is more important for that particular child, or the other vision therapy, or the visual examination is more important, and we stuck in between these things. So we thought that let's just open a clinic where everything is accessible to the children's, specifically the special children's, autistic, ADHD. And this was the basic, like it was not the only me who wants to open the clinic. The we can say the uh, uh, the thing goes to my husband as well.
Yeah.
He supported me in everything. We opened the clinic, and now we are running it very well. We have a lot more patients of autism in which we do vision therapy. There are many amblyopic patients as well for the vision therapy, and also according other than this, we have occupational therapy patients like with ADSD, cerebral palsy. There are many things in the children, specifically in the special children's, to do in terms of vision and in terms of rehabilitation. So these are the things which motivated me to open my own clinic.
You're so lucky, I could tell you, Simi, having a partner who is also interested in your job, and it goes hand in hand for both of you to start a clinic wherein you are treating special children. So that's really nice. Um,
That's what.
so my next question is for Vikram. So Vikram, how did you plan initially when you were starting your practice? Like you said, your dad was your own main reason to start your practice. So how did you plan to set up your clinic?
You want me to speak truth? I would like to work continuously in the hospital setup only. So once after deciding that my career is taking a turn and I'm coming here, so I thought whatever we are doing, wherever we are doing, we should give our best. So based on that, I thought whatever best we can implement in our clinic. So from the day one, I I wanted all the good services to be given to the patient. So from there, I I bought the instruments according to that. So now I'm doing it better, I think.
So how long did it take for the planning of setting up your clinic, setting up the optical side, setting up the like you got the instruments, etc. So how did the planning go about setting up the clinic?
I had a very short time. So in 1.5 months, I opened the clinic. After resigning, in 1.5 months,
Wow.
I made everything ready and then I opened the clinic. Within that one span of 1.5 months, I went to purchase stocks for opticals and all, which is very new to me, where I never went in my lifetime. So that was the first step where I went. Then the instruments. I had a little bit of instrument knowledge, where to get the instruments
Yes.
from. So how to make the installation of the instruments. So I had little knowledge on that. So it was quite easy for me when I came for this. So as soon as I gave my resignation in the hospital, I went for seeing instruments in my notice period itself. So that time only I analyzed
Okay.
which instruments should I get, what and all services I should give. So from that time, I was analyzing which company of instruments to buy, where to start. So everything I had duration of 1.5 months. In that, I was setting up everything one day by one day. So
Okay.
all days in the duration I was very much busy, and it was hectic actually to
Yes.
start something new.
In a very short span you could actually start, and I'm so glad you're doing the comprehensive eye examination, and your motto to give equal service to everybody is something which is inspiring to all of us. My next question to Simi is the same thing. So now you say you have a different kind of setup now. Obviously you are doing a lot of screening and therapy for children with special needs. So how much time did you take in planning, setting up the clinic, etc., Simi?
So uh, actually it takes a long time, and all of my savings too, our savings too. It's like I resigned in from GT Bank University in June, and from June till October. This was the time which I did everything, from starting from the instruments to setting up all the things, creating the rooms, how the size of the rooms, the size of the creative room, the sensory room, everything, the waiting area. Because see,
Yes.
there are special people, children, so they are not going to come alone. They must be coming with their parents. So I have to create a waiting area, and I have to make all the things more creative, so that child can uh, enhance or learn more things, or love to come here again and again, because it is
Yes.
a therapy thing, and every day child has to come, right? So all these things I have to keep in mind. I started creating things, and I started crafting. I designed many things in this way. And then the toughest part, as the Vikram said, that knowing which instrument to buy from where and what is the best.
Right. Yes, yes, right.
And how this is the difficult thing, I definitely say, Vikram, and you are going through it, so you must be knowing that, like, which instrument I should buy, and how, what is the exact price, like, it is because we are spending money, so we have to think in terms of price as well, right? So in everything I managed, and then I purchased one by one instrument at a time, then again next. And for that I used to go old Delhi, and I visited the international optic fairs as well in meanwhile time, when I was thinking that I have to plan for that. And the toughest, last part, that is the optics part, because spectacles and everything I was not aware at all, because what is, from where the lens I have to purchase, from where the spectacles I have to purchase. For that, some of my friends like Jitendra Rathi, and my one of my friend Ritesh, these people help me a lot, because they have their own clinical setups, and they have their own optical setups. So they told me that go there, talk to that person, talk to that person, and in this way I manage and things, and does the things.
That's really nice to know, Simi. My next question to Vikram would be, so Vikram, so do you have now you have the facilities that you're in your clinic. So are you planning to, what are the marketing strategies that you plan, and also what have you employed now? How important is marketing, do you believe, in getting patients to your clinic?
I'm in a rural setup, a tier 2 city right now. So marketing is more important than setting up something. That is what I felt. So from
Yeah.
the start of the day, I was more into marketing in different media platforms. Like I used to give notices are all over the town. I used to promote my clinic in newspaper
Okay.
advertisement like that. Uh, I also do digital advertising like Instagram, Facebook, and I also thought of reaching a larger audience. Example, cinema theater, movie theater. So I also
Okay.
went on giving advertisements in movie theaters just for them to know that something is running up over here. So something has started here. So just for that, I'll be doing everything in a periodical manner. Nothing
Okay.
one
Okay.
time is what to say. They don't remember when you do it only one time. So in
Yes.
periodically, I'm keeping on doing it alternatively. So lot of
Okay.
expenses are going behind all this. So we can't do it, everything at the same time. So I'll plan accordingly. I'll do one by one. This month something. So after 3 months, I'll do something else. Like that. I just want to register the name of the clinic in their mind. So
Yes.
whenever they think of something related to eye or any eye problems, they should reach us.
That's really nice. How in tier two and tier three cities, the interesting part for me was advertising in the movie theaters, going out and advertising there. This is really nice to know. I'm sure most of the listeners who are there on Facebook Live today would get a new insight about doing the marketing in different technique. Thank you, Vikram. Simi, same question to you. So, how did you start marketing your clinic? What is the footfall that you're seeing right now?
Okay. So, first of all, I'll tell you about the marketing techniques. So, basically, I believe in trust building. So, one on one patient counseling, whenever a patient comes to me, I counsel so that they follow up. That is very important. One of the reason for losing patient is the loss of follow-ups. Okay. So I focused on that. Then I started meta ads to introduce about my clinic, because majority of the people don't know about, specifically in the cities like Aligarh, what is optometry, what is rehabilitation, what is occupational therapy. People don't know about that. So I have to create social
Yes.
media contents. I created reels, videos, and I created my Facebook page, Instagram page, because more of people are somehow on the Instagram and the Facebook. So I created there, and then also I
Yes.
created my website of the clinic, so that people can go and visit and know about what is Vision and Vitality Center, what all things are. Other than this, I do screening camps, specifically in the schools, because the learning disability or the things comes from the school, right? So I screen, only me screen more than 900 students along with my team, uh, individually, by class to every in the most reputed schools of the Aligarh, and convincing them was the challenging thing for me. Like, I want to screen the all the people of your community, or all the people of your school is very difficult convincing that आप सारे बच्चों को आप, you will screen all the students. That screening process, that convince the principal or the director, is very difficult for me. Now, the footfalls, if I say that, the things which are very difficult for me to opening in the clinic is, first of all, they hardly know about the optometry or the occupational therapy or the things. Other than this, here the backwardness is quite there. There are still backwardness present, and the people, specifically the girl child, The parents doesn't want their child to wear spectacles. I'll just tell you, a patient or a girl child who is having -4 astigmatism of -4, and he was not ready to wear the glasses. The girl itself doesn't want to wear the glasses. He said that no, I am not going to wear. The people will the student or the children's will what I say
Yes,
that
she'll
uh,
definitely have that bullying, etc.
yeah, they'll bully them. And what will the parents also say that how will we manage once he get married? How can we give them spectacles? Like this kind of thinking still persists. I born and bought in Delhi, so I was not expecting these things from the people. So these are these are the challenging things which I actually encounter here when I started the clinic.
Okay, okay. So along with beginning the clinic, it's not only about marketing, it's also about facing certain challenges that really comes along the way.
Yes.
And it's really nice to understand how you cope up through these challenges as well. My next question to Vikram is so Vikram, now that your clinic, as you said, you have comprehensive eye examination facility in your clinic, and how are you managing competition in the industry now? You said you are in the rural side of the practice, but still, how are you managing the competition?
So if you take our town, there are well-established optometry clinics. They are already present. So after they are 25 years old clinics actually. So after
Yeah.
that, I am the new one to enter the city with this optometry clinic. So there's a huge gap difference. One. So it is actually challenging to make more patients to walk in first step. So my one more thing, as Simi ma'am said, the patient count is increasing day by day by word of mouth only. So whoever the patient actually visit first, so based on their experience, they suggest it to some other friends or relatives. So that is the first step of my increase in footfalls inside the clinic. More than this
Yes.
marketing strategy, the advertisements and all.
Building
So
trust is very important,
yes, yes,
like
and
you
the
said.
service and the experience, whatever they are gaining from the clinic when they walk out. So last month also I had made a ad campaign in Instagram saying that all school children when they are entering new into the schools they get a free eye checkup when they come in, and the parents who are bringing
Okay.
the children for it just normal comprehensive eye checkup gets a discount in their consultation. That was the ad campaign that I did last month. So it actually increased a little bit of footfalls inside the clinic, and I was actually surprised to see the results because I was expecting that children with normal vision will walk inside the clinic for getting a regular eye checkup. But all the children who were entered inside had some form of vision impairment. So I didn't see any single child coming inside with a normal vision. I was seeing patients 7 people, myope, that and all I was seeing, and I prescribed them last month. So they want some force to push them inside. Then only they are coming for their problems also, not only for regular eye checkup. Even though they have -7 myopia, they are not coming for eye checkup. The parents are saying the child is complaining for 2 years, but still they didn't go anywhere for their eye checkup. And this free strategy actually gets in instead.
That's
Yes,
nice to
exactly.
understand,
When I
Vikram.
was Yes, exactly, Vikram. When I was screening the children's, specifically the primary school children's, they the same thing, same problem. I get to know that there are many childrens who are having vision problems, specifically myopia or some kind of refractive error or some kind of anomaly, but the parents are not taking their children to the clinic to show. They are saying that I thought they must be joking, or they are just doing saying this way only.
Actually, the awareness level is very low,
Yeah.
and that is what I am aiming to do. And every ad campaign, whatever I am doing, I'll also add some points of awareness. behind the notice or whatever. So what should you should be aware and what you should come for eye checkup and why you should go for an eye checkup. So the basic uh, common eye problems or eye disorders that will be also printed on the notice and all.
That's nice to understand that you're also creating awareness along with not only just marketing and getting in the patient showing discounts, but awareness is very important, as you all said, which is really a great job. My next question to Simi would be, Simi, can you share any case wherein, as an optometrist, you had made a difference in patient's life? I would like to hear your story wherein you have diagnosed a kid with special needs and you had explained them or convinced them that vision therapy is very important to them.
Yeah. Eh, uh, See, when I started, there is a lot of stories, but I just start with the toughest one, and then I'll share one story. Like when I started the clinic, there are many patients come, and I found that they need a vision therapy. I convinced them. Told them, yes, please, it is very important for the child. Blah blah. I tried every possible points to convince the parents, but they are not ready at all to take, because they are ready to go outside the Aligarh in the Delhi and get the therapy over there instead of coming to my clinic, or get the things already in the Aligarh. But this was very challenging. Then a child, then a child of approximately was of 6 years old or 6+ years old, is having autism, or uh, I diagnosed he's having some vision problem. He's having high refractive error and learning disability along with the autism. I found my husband examined or assessed the patient. He found that yes, he is having autism plus learning disability. Let's just do the therapy. I said that he is having learning disability and his visual things are not appropriate. I am not seeing that he is capable to find the things. So I did the examination, visual comprehensive eye examination of that child, and I found that he's having a high refractive error along with the myopia. And because of that, he is having learning disability, because he was unable to see the things. How can he be able to learn, right? So this this totally the treatment totally changes for that particular child. And we did the occupational therapy, we did the behavior along with the vision therapy. We convinced the parent that it is important for him. And now after being 6 to 7 months, he is improving a lot in its academics as well, in its hyperactivity as well, and the vision is also improving. So
That's nice to hear, Simi.
the,
Uh, yeah, so do
challenge,
you see the impact? How happy do you feel after seeing the impact after doing the vision therapy
yes,
and
I
everything?
am I'm very very much happy. And I was like, wow, the parents are saying wow. The
Yeah.
best thing which we receive is parents, or the, the child, when he does the things properly. That was our award, or we can say
Yes,
that is the thing which we actually need.
absolutely. Yeah. That's nice to know, Simi. Vikram, can you share any of the patient story from your practice? You said you have already diagnosed glaucoma patients, which is actually a very rare case to understand and to make the patient understand in rural area about glaucoma.
So as you said, the first step was I am checking intraocular pressure for everyone who is coming inside. So for those who have higher IOP, I usually advise them to consult an ophthalmologist and get back to me to see what the diagnosis or what the findings, because all high IOPs may not land into glaucoma, right? So I want to know what was the final diagnosis and how the patient is doing right now. So there are 6 patients, as I said, they were diagnosed with glaucoma and they are into continuous treatments. Uh, for there is no actually ophthalmologist nearby, so they want to travel to cities to get their treatment. So now it is becoming easier for them. So for not all, for every month follow up, they are not traveling there. Rather, they are coming here, getting an IOP checkup, and then seeing for the API patency or whatever they underwent, and then they are just communicating it to the consultant or doctor who are they are treating, and it is making their life and time easier. So that way, I am impacting in their life. And also, I suggest vision therapy to the needy people here, but making them understand is a very big difficulty
Right.
whatever I'm facing. So whatever wherever we go, they'll come for glasses. So they
Yeah.
understand only glasses. So more than glasses,
Correct.
if I say or suggest something, it's very difficult for me to convince them. Till now, I gave vision therapy to only three people. Out of these three, two people actually went off in the mid of the session. So they are not ready to come back. So one person came. She had ideas which was very much breaking without breaking the fusion. The ideas was appearing and disappearing. So after few sessions of fusion therapy, he felt very much better, and there was no ideas that was actually that much present. It kind of it came into exophoria. He actually walked inside the clinic asking for prism glasses. So he went to some hospital. There they told, I have exophoria. Please give me prism glasses. That is what he actually entered inside the clinic. I told I will evaluate you. Then I will answer to your question like that. I told. He told if you do free eye checkup, I am ready to do an eye checkup. I told I'm not going to do free eye checkup here, because whatever I am doing is my expertise, and it consumes my time, and
Yes.
the diagnosis actually takes a little time to do. So then after doing everything, all the vision therapy, he is now satisfied, saying that previously I went only hospitals where they did only free eye checkup, but now I understand the difference, and he's better now. He's doing better.
That's really nice. Now, the hot topic among all of the optometrists who open their clinic, because we have a lot of industry coming in the optical business who offer free consultations. So, what is your take on offering them free consultation, Vikram? What do you think we should charge them, or should we really continue with the trend offering free consultation if you buy glasses? All these marketing gimmicks that we would like to say.
Actually, I don't support free eye checkup, because we have gained some expertise in this field, and we are trying to provide something to the patient which involves our time, our expertise, and also the equipments or whatever investment that we are doing. So the basic
Yes.
operation cost at least should be covered from this consultation, more than the business or opticals whatever I'm seeing. And we should charge patients. You can charge little also, no problem, but there should be a little bit of consulting fees for them to respect this eye examination when they walk in.
Simi, what's your take on charging patients for consultation?
Yes, definitely. I also charge for consultation, and see, basically, the money is not the matter. The matter for I am taking consultation is the value of our services or our time. That is the important for us, and that's why I am charging for the consultation. So I for every comprehensive eye examination I charge.
Yes, yes. So definitely we have to respect our own time and value that we are offering to patients. And yes, a certain amount of consultation charge is definitely needed for all the patients, unless they really cannot afford the consultation fee. So my last question to Vikram would be, so now you're involved in the community screenings, and so, how do you think about expanding this idea? And also about your clinic, do you have any idea of expanding your clinic?
Right now, it is just 3 years. I just recently completed my third year anniversary. Uh, Still, I am facing a lot of struggles over here to withstand the clinic. So right now, I am not in the plan of expanding, but in the near future, maybe I may think of doing so. So first, we'll have to stabilize, focus over here, and the other main thing is the manpower. So in this tier 2 city, I don't get any optometrists to come and take care of this clinic if I want to expand also. So I am the only person to take care of everything over here. So right now only I have included a person for sales and then training them slowly. So it actually requires a lot of time.
That's nice,
And
Vikram. Actually, the idea of running a clinic alone itself is a biggest task, and I'm sure you're definitely strong with even overcoming challenges and everything. So, Simi, what's your take on expanding your clinic or also offering different services to people in your clinic?
Uh, right now, it is we haven't completed 1 year, uh, but we are having a significant number of patients. I'm happy for that. But currently, I want to focus on this clinic so that I can do more in behavioral optometry or in terms of behavioral part more of, and then I will see. I am not getting even a single patient till now for the low vision rehabilitation, which is one of my own interests. So I am working on that, improving vision and footfalls of low vision rehabilitation in my clinic, and sensory integration part. So these things I am going to incorporate in this clinic as well. I'm not going to open another one right now. I just focus on this current one. And also we don't have manpower, as Vikram said. Like me and my husband both are doing the things. Like we don't have more of a manpower. I have to do, see, when we do the online things, I have to do create the video, I have to edit the video, I have to incorporate on everything on the by my own on the online platforms. So it was a bit difficult for me, but yes, I am doing, and I'm learning many more things in on in softwares as well, like meta ads and everything. So I'll just do more that things more than.
Yeah. So before we conclude, I have one last question to both of you. What is the message that you would want to convey to optometrists who would like to start their own practice? We'll start with you, Vikram.
it is actually a nice idea to start something by yourself and slowly build it up to a certain mark. People definitely will enjoy their way through this journey, but they require patience. So for me, when I was starting, my seniors told it will take minimum of 3 years for you to stabilize, and I'm just right around that time. I'm still finding it a little difficult. So I hope in another 1 or 2 years I'll be a little bit better compared to the previous years. There will be a lot of demotivations in this course, but we'll have to withstand by and then do everything. Last week also, I had one of my known person walking into the clinic asking me to, why are you struggling so much? You can go back, join your work over there where you are working. You are doing good like that. So there will be a lot of demotivations that we will be facing, but still we have to keep our mind focused. We should not get
Yes.
distracted by others' words around us. So we can do it, but it needs time. That is the main thing. And
Thank you, Vikram.
after
Yeah.
seeing Simi ma'am's clinic, I thought it will be minimum of 5 years after she has opened the clinic. There were a lot of things inside her clinic, but I am surprised to know that it is less than 1 year, and it is actually very good that she is doing so much within this 1 year of time. So she actually inspires many more people to do more things, not just uh, vision check, not just comprehensive eye examination. More than that, she is seeing autism kid, vision therapy, the occupational therapy, including all this actually adds more value.
Yes, our main idea behind running this program is to inspire optometrists to do good in their private practice, and also expansion of practice is very important, and also to understand the marketing techniques that each of you use in your own clinic. I'm sure we are never thought of about marketing, business, etc., when we are studying bachelor's or master's in optometry. So this is something new for all the optometrists and also budding optometrists to learn about. Simi, I would like to understand your message. So, what's your message for new optometrists or the optometrists who would want to start their clinic?
So I just say that start small but start strong. Make your own ethics. Doesn't just follow the other ones that those person are doing this and you have to do the same thing. You just make your own policy and follow that. That is the main thing which is very much important in opening your own clinic, that your ethics and your value should be different from the other ones. And other than this, three things which I think that is important. One is the branding of your own clinic. Like you have to do, हिंदी में कहते हैं, in Hindi we say that जो दिखता है वो ही बिकता है, right? So you have to brand yourself and you have to present online. You have to be online, like you have to be present in Instagram, Facebook, or all the social media networking sites, because these things basically directly or indirectly gives us patience. And the third thing, that is education. Educate your patient well, because once you educate them, they will come back to you because they know that you know. If you don't educate them, you don't tell everything, then they will Google and they won't come back. So these are the things which I think it is important for the budding optometrist to know about.
Thank you, both of you. It was really a wonderful session with both of you to understand private practice, how you run your clinic, how well you see your patients, managing patients, and everything. I would like to thank Optician India magazine for being the media partner for this series and also providing gifts of Prodigy Eyewear to our unsung heroes. Thank you, Simi, and thank you, Vikram. Not Last but not the least, I would like to share a PPT of Optician India. So we would like to thank Optician India once again uh, for being our media partner for this program. So before any further delay, we are winding up the session. Thank you both of you for your time. I think you can get back to your clinic to see your patients now. Thank you,
Thank you,
Simi.
ma'am.
Thank you,
Thank you,
Vikram.
Team OCA.
Thank you, Vikram, and thank you, ma'am. Thank you, Optometry Confederation of India and Indian Optician, for giving this opportunity to talk and discuss things about. Thank you.
Thank you, ma'am. And thank you, Team OCA, for hosting us here and making us know to the circle where we are present.
Yes.
Yes, definitely. Thank you, both of you. Thank
Thank
you.
you.